Good day. You are welcome to Campbell Anatomy. Here, anatomy has been made easy for all students studying it. Either you are anatomy student, medicine student, physiology, or public health, this is the right channel to teach you anatomy the way you want it to be taught. The topic we are treating right now is Ischioanal Fossa. Pay a very good attention as I take you through the topic. Let's dissect together. The Ischioanal Fossa is a wedge-shaped, fat-filled space located on each side of the anal canal, just below the pelvic diaphragm. On your screen, we have two images, one on the right and the other on the left. The one on the right shows a coronal section through the pelvic bone or through the pelvic region, and on the left side we have another image that is showing the floor of the diaphragm viewed from the pelvic outlet. These two images are showing the Ischioanal Fossa. In the image on the right hand side, the area painted yellow are referred to as the Ischioanal Fossa, and the yellow paint signifies the content, one of the content of the Ischioanal Fossa. Same thing goes for this other image. This very area is the Ischioanal Fossa as well. In the image on the left hand side, we can see this area. These two areas are the Ischioanal Fossa. Now, these two images are showing us the Ischioanal Fossa from different perspectives. In the definition, they said it is a wedge-shaped fat-filled space. The name wedge-shaped means that it looks like the shape of a wedge. Let's take for instance, there is a shoe that the sole looks like this. This shape is a wedge shape. So they are comparing the shape of the Ischioanal Fossa to the shape of this shoe, or to any shape that looks like this image. That is why they call it wedge shape. And they went forward and said it is fat filled, meaning it contains fat. It is stocked. It is filled with fat majorly. And it is found on each side of the anal canal. So the anus is found in between. There is a measurement to the Ischioanal Fossa. We have the measurement that goes from the ischia tuberosity to the external anal sphincter, and the measurement is called the width measurement, which is 2.5 centimeter. Another measurement is the one that goes from the anterior to posterior, and it is measured 5 centimeter, which is called the length. That is the length, 5 centimeter. Now, the other measurement is the depth measurement, that is how deep the Ischioanal Fossa is from the outward inward. So if you put a ruler inside from outward to the inside, you will notice that it is either 5 or 6 centimeter deep. So we have three measurements now. The 5 centimeter, which stands for anterior posterior, the 2.5 centimeter, which stands for the ischia tuberosity to the external anal sphincter, and the depth, which is either 5 or 6 centimeter deep. Now for the boundaries. Boundaries are simply walls that joins together to form the space. These boundaries can be formed by bones at times. It can be formed by muscles, depending on the anatomical structure you are treating for the moment. In the case of Ischioanal Fossa, we have the following boundaries Number one is the base boundary, which is formed below by the skin. The second is the apex, and the apex is formed by the junction of the obturator fascia and the anal fascia, which is also known as the inferior fascia of the pelvic diaphragm. The next is the lateral boundary, which is formed by the obturator internus, including the fascia and at the same time the ischial tuberosity. Now the medial boundary. The medial boundary is formed by the external anal sphincter and the levator ani muscles. They are found medially. The external anal sphincter is the muscle around the anus, and it helps to maintain fecal continence. That is, it helps to stop involuntary defecation such that you'll be able to control defecation. Now the anterior border. The anterior border is formed by the posterior border of the superficial perineal muscle or the perineal membrane. For the posterior border of the Ischioanal Fossa, we have the inferior border of the gluteus maximus and the sacrotuberous ligament. The sacrotuberous ligament is the ligament that is joining from the ischial tuberosity to the sacrum, while the gluteus maximus is the major muscle of the gluteal region. Together, they form the posterior border of the Ischioanal Fossa. This is the summary of all the boundaries, so you can take a proper look at this and memorize them, study them properly. They are important. Now, let's talk about the recesses. Generally, a recess denotes a kind of space, or rather a pocket, an area that is hidden at a certain place in the body. I'm going to use an analogy to describe what a recess means. Now, I'm going to refer back to the use of a shoe. A shoe. Now, in a shoe, there is a part where the heel will be sitting. Think of that part as the Ischioanal Fossa, while your leg will form the fat that is inside. Now, there is a part in the shoe that only your toes can get there. So, the elongation from your ankle to your toes will only enter into this part of the shoe. Now, that part of the shoe is referred to as a recess. Remember, we are using this as an analogy. So, that part of the shoe, count it as a recess. So, the recess of the Ischioanal Fossa now, they are like the hidden areas which you can only put your hand into that place. You cannot just see it openly the way you see the Ischioanal Fossa. They are like extension of the Ischioanal Fossa. Those are recesses. And we have several of them. We have anterior recess. We have posterior recess. Now, the anterior recess. The anterior recess passes under the superficial perineal muscle, under the deep perineal muscle, anteriorly towards the pubic tubercle or towards the pubic region. And it has relations such as prostate. The prostate gland can be found around there, and we have the vagina close to it. Those are closely related structures that are found near the anterior recess. Now, for the posterior recess, do not forget that I said recesses are like pockets, they are like hidden areas. So that's why I said that for the anterior recess, we have it going under the superficial perineal muscle to the deep, to under the deep perineal muscle, anteriorly to the pubic region. Now, for posterior recess, the posterior recess is a bit smaller than the anterior recess, and it passes under, like it goes beneath the sacrotuberous ligament posteriorly. So it is smaller than the anterior recess and it is towards the posterior region. That's why you are seeing it in the arrow there. The arrow signifies it that it goes posteriorly towards the back. So it's the posterior recess. So it means now that it is directly under the sacrotuberous ligament and even the gluteus, the inferior border of the gluteus maximus, according to this image here. But majorly and originally it is under the sacrotuberous ligament. Now, the third recess is the horseshoe recess. And the horseshoe recess is just like a passageway that is formed in between the right and left ischioanal fossae. So it is connecting both right and the left fossa together. So that is the horseshoe recess. And it is also behind the anal canal, just behind the anal canal. You can see the anal canal at the center, you can see the anus at the center. So the horseshoe is behind it. You can see the arrow there that I used to denote it. The arrow points left and right. So it is a kind of passageway connecting left and right ischioanal fossae together. There is a space around the ischioanal fossa as well, and it is called the perianal space. As the name implies, perianal space. The word peri means around or close to, or you can say nearby. So perianal, we all know what anal means, the anal canal, the anus, like that. So now, perianal means around the anal canal. So it is a space around the anal canal, perianal space, and it is small, so very close to the exit of the anus, and it is embedded subcutaneously under the skin. It is embedded under the skin. Now, the perianal space consists of tight, small loculi fat, and the tightness can cause pain and swelling whenever there is a kind of infection in the perianal space. So an infection in the perianal space causes a lot of pain just due to the fact that the fat in the area or in the perianal space is tightly packed. Now, these are the list of contents that we have in the ischioanal fossa, and these contents are the structures that we can find in the space that forms the ischioanal fossa. So I said the ischioanal fossa is a space, and that space there are anatomical structures that are occupying it. So these contents are the structures you can find inside the ischioanal fossa. Few details about the content. We have number one most abundant content of the ischioanal fossa, which is the fat pad. The fat pad is the most abundant content of the ischioanal fossa. As you can see it in the image here, we have the fat pad. Then we have the posterior scrotal or labial nerve. The posterior scrotal nerve or the posterior labial nerve, including the posterior scrotal vessels like the posterior scrotal artery and the scrotal vein, including the labial vessel, which are the labial artery and labial vein. Then we have the rectal nerves and the rectal vessels. The rectal nerve, the inferior rectal nerve, the inferior rectal artery and the rectal veins. They are part of the contents of the ischioanal fossa. Then another content is the pudendal canal. As you can see in the image, it is sidelined. It is laterally placed, inferior-laterally placed, and it is formed by a kind of fascia, demarcated by a fascia. So inside of it, we have the pudendal artery, the pudendal nerves there. So this is the list of the clinical conditions that can occur in the Ischioanal Fossa. Now, a few details about them. Now, let's talk about the abscesses. In abscesses are like the accumulation of pus. Now, a pus is formed when the body is trying to fight an infection. Then there will now be a buildup of fluid that contains white blood cells and all. Now, there are types of abscesses in the Ischioanal Fossa region. Number one is the supralevator abscess, and this one is found above the levator ani muscle. Secondly, we have the ischioanal abscess, which is formed in between the fat or in the ischioanal space. It is less painful just because the fats in the ischioanal space are not tightly packed, they are rather loosely packed. Thirdly is the perianal abscess, which builds up in the perianal space. So that area is the perianal space, and inside of this is the perianal abscess. Then we have the intrasphincteric abscess, meaning it is in between the both internal and external anal sphincter. Having known all this, the abscesses that we just learned about can further result into another clinical condition known as the fistula in ano. Fistula in ano is formed when the abscesses are drained or when they burst. Now, what is fistula in ano? A fistula in ano is like a channel or a tubular channel or a tubular pathway that is linking the anal canal to the external part of the body, like to the skin. It's linking the anal canal to the outward part of the body. To the outer part of the body is linking it out through a channel. So the channel is coming from the external from the anal canal, and it links out of the skin of the body near the anus. And the implication of this is intermittent discharge of pus, and it can be so irritating. It can give a itchy sensation. So that is for fistula in ano. It is as a result of the bursting or drainage of the ischioanal or ischiorectal abscesses. So if you are able to see the tutorial this far, I congratulate you. You have seen the end of the tutorial. I appreciate your presence, I appreciate your attention since the beginning. Please do well and subscribe to the channel so that you'll be able to see whenever we upload another video on any anatomy topic at all. Trust me, you are going to really enjoy it. Thank you so much. My name is Samson Victor Olabamiji. Bye.